Gentlemen, imagine this. Tomorrow morning, you wake up, you walk to the mirror, and your face looks less tired. Not younger overnight. Not airbrushed. Just calmer. Less dry. Less pulled tight. Your skin looks like it actually rested. Your eyes look clearer. Your jawline looks a little more defined, not because you changed your genetics, but because your body is holding on to hydration the way it's supposed to. Now here's the uncomfortable part. Most men try creams, expensive serums, and anti-aging routines while completely ignoring the simplest lever that influences skin firmness: how your body hydrates at the cellular level. And if you're the kind of man who drinks a lot of water and still feels dry skin, dull skin, or puffiness in the wrong places, this video is for you. Because the truth is, there's no magic switch.
No miracle powder.
No one ingredient that erases wrinkles. But there are proven steps, simple, cheap, and safe for most men, that can support collagen function, help your skin look firmer, and reduce that dehydrated, crepey look, especially after 35, and especially after 50. And it starts with a surprising idea. For many men, plain water alone isn't the best way to hydrate. Not because water is bad. Water is essential. But because hydration is not just water in your stomach. Hydration is water inside your cells, and your cells need the right minerals to pull that water in, hold it, and use it to repair tissue. So today I'm going to show you exactly what to add. Clean, halal-safe, and medically responsible, so your hydration actually supports your skin, your energy, and your recovery. And I'll give you a clear 7 to 14-day plan so you can test it without overthinking. Now, let's break down the why. In plain English, your skin isn't just skin. It's an organ. It's a living tissue that relies on steady blood flow, stable blood sugar, low inflammation, and enough building blocks to maintain collagen and elastin. When hydration is off, your skin can look older even when you're healthy. And this is where most men get it wrong. They think, I'm drinking water.
Ai fine.
But if your body can't hold on to that water, you may end up in a cycle of frequent urination, dry mouth, headaches, low energy, constipation, and skin that still looks dry or tired. So, why does this happen more as you age? 3 key mechanisms. Mechanism number 1. Electrolytes are the keys that let water enter cells. Think of your body like a city. Water is the delivery truck. Electrolytes, like sodium, potassium, magnesium, are the traffic lights and the warehouse doors. If you have plenty of trucks but no keys and no doors, the delivery doesn't get inside where it's needed. When you drink plain water, especially large amounts quickly, you can dilute electrolytes temporarily. Your body may respond by flushing water out to protect balance. Result: you pee more, but you don't necessarily hydrate better. Cellular hydration depends on the balance of water and minerals. And when that balance improves, many men notice better muscle function, fewer cramps, steadier energy, and yes, skin that looks less dehydrated. Mechanism number 2. Glycation and inflammation stiffen collagen. Collagen is like the scaffolding under your skin. Over time, it can get damaged by normal aging, sun exposure, and especially by high blood sugar spikes. When blood sugar is frequently high, collagen fibers can become stiff and brittle through a process called glycation. This can contribute to a rougher texture and more visible lines. Hydration helps, but hydration alone doesn't fix glycation. What helps is a routine that supports steadier blood sugar, lower inflammation, and better circulation. That's why the plan I'm giving you includes more than just a drink. It's a short routine that supports the whole system. Mechanism number 3. Blood flow is the delivery system for repair. If circulation is weak, your skin doesn't receive nutrients efficiently, and waste products don't clear as well. Think of circulation like plumbing. If the pipes are narrow or the pressure is unstable, the farthest rooms don't get the water they need. Better hydration plus gentle movement and better sleep equals better delivery and better repair. Now here's the key. This isn't about looking perfect. It's about getting your body back into a state where it can maintain itself. So let's go practical. The 4-step hydration routine: simple, safe, effective. I'm going to give you a routine you can start today. It's designed for men who want better hydration that actually sticks, skin that looks less dry and more firm, improved energy and recovery, and better daily consistency. You'll do this in 4 steps, and I'll tell you exactly when to do each one. Step 1. Morning mineral water. Within 30 minutes of waking, this is the main add this moment. You're not adding sugar. You're not adding anything inappropriate. You're adding minerals that help your body hold water properly. Option A. Simple, reliable 500 milliliters, about 2 cups, of water, a small pinch of salt. What does small pinch mean? Not a spoon. Not a heap. Think what you can pinch between your fingers, roughly 1/16 to 1/8 of a teaspoon. This supports fluid balance, especially if you wake up thirsty, you sweat at night, or you drink a lot of plain water and it runs right through you. Option B. Gentler if you're salt sensitive, 500 milliliters water, squeeze of lemon or lime plus a small pinch of salt. Even smaller than option A. Citrus adds flavor and a little citrate, which some men find easier to drink. It doesn't make collagen by itself, but it can support a routine that improves hydration consistency. Option C. If you don't want salt at all, use an unsweetened electrolyte powder with no stimulants and no megadoses. Look for something that provides sodium, potassium, and magnesium in reasonable amounts, and avoid products loaded with sugar. Now, important. If you have high blood pressure, kidney disease, heart failure, or you've been told to limit sodium, do not start adding salt without speaking to your doctor. I'll repeat that in the safety section, but I want it clear right now. For most healthy men, a small pinch in the morning is a gentle, practical change. How to drink it. Sip over 5 to 10 minutes. Don't chug. Chugging can cause your body to flush it. Now here's the key transition. The drink sets the foundation, but what you do next determines whether hydration supports your skin. Step 2. Collagen support breakfast pair. Within 60 to 90 minutes. I'm not going to sell you a miracle supplement, but I am going to show you a simple pairing that supports collagen maintenance. You want a protein source of vitamin C, containing food. Why? Protein provides amino acids used in tissue repair. Vitamin C supports normal collagen formation in the body. Practical examples: eggs plus berries, Greek yogurt plus kiwi, chicken/turkey plus bell peppers, lentils plus lemon on top, protein shake plus a piece of fruit like orange/guava. Keep it simple. If you skip breakfast, that's fine. Just make your first meal include protein and a vitamin C food. This supports the building blocks side of the equation. Now here's the key. Most men focus on what to add, but they ignore what to stop doing. Step 3. Midday hydration timing. The don't drown your minerals rule. This is where most men get it wrong. They drink huge amounts of plain water late in the day with little food while stressed and underslept. Then they wonder why they're bloated, tired, and still look dry. Here's the rule. If you're drinking more than 2 liters a day, don't make it all plain water. Instead, make 1 serving of your day a mineral drink, like the morning pinch salt water, and keep the rest as normal water with meals. Water with meals tends to stick better because food contains minerals and slows absorption. A simple schedule: morning, mineral water with lunch; normal water afternoon, normal water or herbal tea; evening, small sips only. Don't flood your system right before bed. Why? Flooding late can disturb sleep with bathroom trips. And sleep is when repair happens. Which brings us to step 4. Step 4. Evening repair mode. Sleep plus circulation mini routine. If you want firmer looking skin, you need the repair window. Sleep is your nightly maintenance crew. Here's a 6-minute routine. 3 minutes easy walking around your home, or slow marching in place. 2 minutes nasal breathing. Inhale 4 seconds, exhale 6 seconds. 1 minute gentle neck and shoulder release. This supports circulation and downshifts stress hormones. High stress can worsen inflammation and sleep quality, and that shows on your face. Now that's the routine. But you must avoid the mistakes that cancel it. Common mistakes that make skin look worse, even if you hydrate. Mistake number 1. Chugging water. To be healthy, chugging triggers quick urination. Hydration works better when you sip. Mistake number 2. Only drinking water, but eating very low minerals. If your diet is mostly processed food, or you barely eat vegetables, legumes, nuts, or whole foods, mineral balance can be off. You don't need perfection. You need consistency. A few mineral-rich foods per day. Mistake number 3. Living on caffeine and pushing through. Caffeine is an evil. but it can increase fluid loss for some men and worsen sleep if used late. If your sleep is poor, your skin will show it. Aim. Caffeine earlier in the day and water with your coffee, not instead of water. Mistake number 4. High sugar spikes, especially at night. Late-night sweets can increase inflammation and worsen sleep. Over time, frequent spikes can affect collagen quality. Mistake number 5. Ignoring sleep apnea signs. If you snore loudly, wake up gasping, or feel exhausted despite 7 to 8 hours in bed, talk to a doctor. Sleep apnea can accelerate aging signs through poor oxygenation and poor sleep quality. This is health, not vanity. Now, let's build a full lifestyle support stack that makes the routine work even better. Lifestyle support stack. Make the hydration work. Think of this like a team. Hydration helps. But hydration needs support from sleep, movement, food, stress control. 1. Sleep. Your collagen and recovery window. Aim for consistent sleep, wake time a cool, dark room, no heavy meals right before bed. If you wake up dry, consider earlier hydration, not flooding water late. 2. Movement. Circulation for skin delivery. You don't need a gym to support circulation. Minimum effective dose. 20 to 30 minutes walking most days plus 2 to 3 days of basic resistance training. Resistance training supports muscle, metabolism, and insulin sensitivity. Better insulin sensitivity supports steadier blood sugar, which supports collagen quality. 3. Food. The skin support plate. For most men, a simple plate works. Protein, palm-sized portion color, at least 2 colors, vegetables/fruit, healthy fats, olive oil, nuts, seeds, avocado. Carbs. Choose smarter carbs, whole grains, legumes, potatoes, fruit, especially earlier in the day if you have diabetes or prediabetes. Work with your clinician on the right carb plan. 4. Stress. Cortisol shows on your face. Chronic stress can worsen sleep and inflammation. One simple daily tool. 5 minutes of slow breathing or a short walk outside. This isn't soft. It's nervous system control. Now, before we do the challenge plan, we must cover safety. Safety red flags. When to speak to a doctor. Most men can safely improve hydration with better timing and minerals. But some men should not add salt or electrolyte mixes without medical advice. Speak to a doctor first if you have high blood pressure that isn't well controlled, kidney disease, or a history of kidney stones, heart failure, or significant swelling in legs/ankles, liver disease. You're on diuretics, water pills, ACE inhibitors, ARBs, or medications that affect potassium/sodium balance. You've been told to limit salt also. Stop and seek medical care if you develop chest pain, severe shortness of breath, confusion, severe swelling, fainting, severe vomiting/diarrhea with dehydration, very dark urine with weakness that doesn't improve. If you have persistent extreme thirst, frequent urination, or unexplained weight loss, you need evaluation for blood sugar issues. And if your skin changes rapidly, new rashes, bleeding lesions, or severe dryness with cracking, get it checked. This channel is education, not diagnosis. Now, if you're cleared, here's the consistency challenge. The 14-day consistency challenge, your daily plan. This is where results come from, not intensity, consistency. Days 1 to 3. Foundation morning. 500 milliliters water plus small pinch of salt or low sugar electrolyte. Breakfast/first meal. Protein plus vitamin C. Food movement. 10 to 15-minute walk. Evening. 6-minute repair routine. Focus. Build the habit. Don't chase perfection. Days 4 to 7. Stabilize. Continue everything above. Add water mostly with meals. Reduce late-night flooding. Aim for 7+ hours in bed. Optional support. Magnesium from food, nuts, seeds, leafy greens, legumes. If you consider magnesium supplements, discuss with your clinician, especially if you have kidney issues. Days 8 to 10. Upgrade circulation. Keep routine. Add 2 days of simple resistance training. Squats to a chair, wall push-ups, rows with a band, 2 to 3 sets. Easy pace. This supports insulin sensitivity and blood flow. Days 11 to 14. Lock it in now. Pay attention to small changes. Do you wake up less dry? Is your energy steadier? Is your skin less tight? Are fine lines less emphasized by dryness? You're not trying to erase age. You're trying to reduce dehydration signals. Take a simple photo day 1 and day 14 in the same lighting. Don't obsess, just measure. And here's a key point. If you notice swelling, higher blood pressure readings, or you feel worse, stop the salt addition and speak to your doctor. Now, let's make this even easier with a checklist. Daily checklist. Copy this. Morning. Mineral water, sip, don't chug. First meal. Protein plus vitamin C food midday. Water with meals. Avoid huge plain water chugging movement. Walk 20 minutes, or 2 by 10 minutes. Evening. 6-minute downshift routine. Stop heavy drinking close to bedtime. That's it. Simple. Repeatable. Safe for most men. Now, let's close this out the right way. Gentlemen, you don't need to fear aging. You need to understand your body systems. Hydration that actually enters cells, minerals that help you hold that hydration, blood sugar stability that protects collagen, sleep that repairs tissue, movement that delivers nutrients where they're needed. This is not about vanity. It's about control. It's about looking in the mirror and seeing a man who takes care of his health because health shows. Be patient. Be consistent. Give it 14 days. If you want, comment the word routine, and I'll give you a simple printable version of the 14-day plan you can follow without thinking. And if this helped you, subscribe to Dr. Emma Mitchell for practical, clean, medically grounded men's health habits you can actually stick to.